Hello everyone, my name is Frederick Barton and I am an emergency nurse practitioner. I'd like to take a moment and talk about the need for a cultural shift in emergency medicine. Before becoming an advanced practice RN, I worked as a senior firefighter, paramedic, and rescue diver with Newport News Fire Department in Virginia. During my 6 years with the fire department, I delivered babies, I fought fires, I cut people out of cars, I dove for bodies underwater, and I had more than my fair share of Chicago fire calls, if you will. But it turns out that that's not actually the bread and butter of the fire department or emergency medicine in general. Approximately 80% of the call volume of most fire departments are calls that we would consider non-emergent. Patients that require more primary care rather than emergent care. These patients usually don't have access to primary care or don't have the education to know when to go to primary care versus when to go to emergent care. These are a lot of patients that are in rural areas or patients who are in the projects, don't have insurance, don't have vehicles. For any number of reasons, they are using the ambulance as their primary care and their transportation to the emergency department, where they're then receiving treatment. This influx of primary care patients requires a new lens for us to view emergency medicine. EMTs, paramedics, emergency medicine trained registered nurses and doctors are told throughout all of our training that we're going to be treating gunshot wound patients, we're going to be placing central lines, we're going to be intubating, we are going to be performing rapid sequence inductions, we're going to be doing all of these critical procedures to save unstable patients. And the fact is, that is part of our job. That's something that we need to do, and we need to be highly trained and prepared to perform at a moment's notice. But it's not our only job anymore, and it's not even really our primary job. We need to look at this as an opportunity and honor even, because we're really the last bastion of healthcare in the United States. We're the only place that any person can present to regardless of ability to pay, and they can receive healthcare, and we get to treat them, and we need to be excited about that. And it's something that I'm hoping emergency nurse practitioners are really going to be the forefront of this change. We are specially trained in caring and empathy, and we need to take that empathy and we need to apply it to all of our patients and stop judging them because we view their injury or illness as non-emergent, and we believe that they could be better served in primary care, because the fact is we are their primary care. So this has been a really long-winded introduction for really a quite simple plea to my fellow nurse practitioners working in emergency departments nationwide. The next time you walk into a patient room at 2 in the morning from a patient who called 911 and took the ambulance for something that is completely and utterly not an emergency, take a moment, recenter yourself, and reframe the patient. Remind yourself that we might be the only providers that this patient gets to see at all, and treat that patient with the utmost dignity and respect, and really do the best that you can to treat them holistically. Most importantly, though, and this sounds silly, but I truly and honestly believe that this is where nurse practitioners have the greatest role to play. Be a beacon of positivity in the emergency department. When you hear those EMTs or those medics disparaging their patients, or you hear the LPNs or the RNs saying something along the lines of, "Why is Miss Smith here again for that stubbed toe?" Don't buy into that. Be positive about the patient and remind everyone in this healthcare setting that really is an honor that we are able to treat each and every one of these patients. Thanks you guys for listening, and I hope you have a great day.